Hi, this is David Englert here again with another edition of KSM TV How-To Series. And today we are talking about how to find a good chiropractor. And we have Dr. Paul Aaron here, who has been a chiropractor for 29 years, a very experienced guy and also a very busy guy. And we appreciate you taking your time out of your very busy schedule to be with us and help us with this question.
Well, I'm here. I'm here for you.
We appreciate that. Dr. Aaron, you are with the Health Center of Hillsborough. You've been a chiropractor, as I said, for 29 years, and you've probably seen just about everything. So I guess the question I have for you is, as an expert and someone has been in the business that long, what would someone look for when searching for a good chiropractor?
Actually, that's very easy to answer. I know that when I'm out of town and I need to get to a chiropractor myself, what I look for is the person's reputation. You can find that in so many places now. Besides that, I want to know the doctor's expertise, the experience that he or she has had. These three things really mean the most to me.
Yeah, that's absolutely important. You know, I know from talking to you previously, you had mentioned some of the interesting things that you do at your place, and I've had some experience with a chiropractor with my neck, and it's helped me immensely. But there are some other things that you do that are quite unique compared to the average chiropractic office.
One of the things I really make sure I do is that I want my patients to feel very comfortable, so that the kind of technique that I utilize for each individual has to match who they are. It's very easy for me to say, well, this is my technique, but I really want to know what my patients need and what would work best for them. So I have several different techniques available, some very soft and gentle, others a lot more vigorous, and there are people that need one or the other of those aspects on the continuum. I work, of course, with musculoskeletal issues such as back pain and even ankle or finger pain, but I also have a certification in acupuncture that gives me the ability to take a patient from using just the manipulation of the vertebra or the ankle, as I said, but also then to work with the energy, are called meridians, or pathways of energy in the body, to settle everything in and take it to a higher level. Those are some of the things that I do. There are some patients, and I offer this to everyone who's interested, where while I'm doing the acupuncture, I'll offer to take them into a self-hypnotic meditative countdown so that the patient can go into their intuitive, deep core knowledge and find the focus where they can find what it is that they need to do at that very moment to give them the greatest benefit and bring them towards a perfect healing, wellness, and even actually fill them with joyfulness. This has worked really well. And actually, as I work with those things, I also find that patients who have difficulties such as rheumatoid arthritis or hypothyroid, even Parkinson's or neuropathies, respond really well to that. I should add, actually, that the other thing I work with is nutrition. So I might work with specific diet or supplements. We actually have a registered dietitian here in the office, and we also have a blood lab specialist who consults with us whenever needed. On top of that, we have massage therapy and another acupuncturist and another chiropractor. So we have a full office where we can bounce off each other's knowledge and help each other help the patients really get well. Does that cover an answer to your question?
Yes, and I'll tell you, you know, that's way beyond any chiropractic experience that I've ever had, and I spent quite a bit of time with some neck issues, and you know, it's to find an office that does all of what yours does is pretty difficult from my own experience. So I find that quite fascinating, and all the different things that chiropractic can cure. Because, you know, I always thought it was when you threw your back out that that you went to a chiropractor to get your back put in, and then that's all that they did. And I have been learning over a period of time that it's a lot more than just a back adjustment and off you go again. You know, the things that you're doing are just fascinating to me. So I really appreciate the explanations on all of that.
Mm. Just yesterday, I listened to a national radio program. A group of medical doctors were talking about how they are beginning to refer to chiropractors more and more for all of those kinds of conditions. And one of the things we do is to reach out to the community. We offer a free consultation to anybody who wants to just come in and meet one of the doctors or the other practitioners. And then on top of that, we don't just have a quick visit in the first visit. We typically spend a full hour with the patient in their first visit, getting a really complete history, doing a thorough examination, deciding then what is the best approach, even which is the best practitioner to be working with. I'll tell you, it's a lot of fun working here in this office. Because we have all these different people who have such talent and such great personalities. Everyone seems to have the ability to make all their patients feel comfortable.
It's fascinating that you spend that much time with someone before you actually do any type of a treatment on them. I just find that amazing that you spend a full hour with someone to just dig deep into exactly what's going on with them. So I'm personally very impressed by that. So you had mentioned that you give a free consultation to any new patients coming in. And I would say, you know, folks, if you're looking for a chiropractor in your area, the advice that you've just been given by Dr. Aaron is something that I'm going to take for myself and use it. If you're in the area, and I just want to ask you, Dr. Aaron, if you want to just talk about the areas that you're close by that people in your area would be familiar with, so that they know how close you are to where they are.
Well, Hillsborough is actually where the American Revolution started, before Boston, interestingly enough. And then we are located essentially between Durham and Chapel Hill, North Carolina. We're not far from Raleigh and Cary, or from the other side from Greensboro. We're right in the middle between all of those towns. But there are patients who fly in and stay here for a period of time in order to work in our office. I think we have something, I want to say, special to offer people. So therefore, even that kind of geography doesn't seem to be a problem for them.
Yes, I can see why. And so, folks, if you would like to get in touch with Dr. Aaron and visit him for a consultation, he is able to be reached by calling the number on the screen here, which is 919-241-5032. Again, that's 919-241-5032. And you can also visit them on their website at youhealit.com. And I find that also a really interesting website. Dr. Aaron, can you maybe elaborate as to why it's called youhealit.com?
Well, we wanted to find a name that reflected what we were about, and I feel that my patients are really the healers. Our job as doctors is, in a sense, to be a tool to help a person find what it is that they need to do to heal. And of course, we need to have our specific techniques and so forth. But really, if the patient is not making a move in that direction themselves, then we're fighting with each other. And I really want my patients to flow into their healing and utilize what they know to make themselves really well. You heal it, after all.
Fascinating. That's great information, Dr. Aaron. I really appreciate you taking the time out today to come on this interview and explain all this and be so helpful to so many people. So we appreciate that.
It's a pleasure to be here.
Well, folks, there's some information there for how to find a great chiropractor, and tune in for the next episode.